Hey my lovelies, Dr. Erin in the house. Pull up a pew, grab a cup of tea. This is going to be a bit of a sit down, talking you through some of the similarities and the differences as far as I see it as a psychologist who does therapy and coaching in Australia. So what are the differences between the two? Because people ask me all the time. And whilst you can do a Google search and that's useful, I think some of the people who have an opinion about this have never trained as a therapist, never trained as a coach. They're either one or the other, and it's maybe their opinion based on, oh well, I did therapy and this is what it was like for me as a client, thinking that that is a whole broad perspective. So therapy as a word, in the way that it is used, means different things in different places. So I trained as a clinical psychologist, and therapy for me means that it's structured, it's results oriented, it's about behavior change. It's not psychotherapy or psychoanalysis as some people think of or understand therapy to mean, which I think is a common thing in the US. It's not necessarily that people in Australia don't do psychoanalysis and they don't do psychotherapy, but if you've trained as a psychologist in Australia, most of us are working under the Medicare Better Access scheme. So with that, you can do cognitive behaviour therapy or interpersonal therapy. Things like hypnosis, EMDR, somatic experiencing, there's all sorts of different types of therapeutic approaches, but Medicare technically only covers 2. So my approach is probably quite different from someone else's and what they understand to be therapy. So let this be a very, very general thing. But even my coach, I've heard Preston Smiles talk about how the difference between coaching and therapy is that therapy is talk, and it takes forever. And I'm like, no, dude, that's psychotherapy. That's not what I do. That can be amazing for people. And I definitely know people who use psychoanalysis and use psychotherapy and have been to it and think it's amazing. It's just not what I do. So I can't wouldn't talk about what that is like versus doing coaching. I'll talk to you about what it's like from my perspective as a psychologist who's worked in Australia in private practice for more than 10 years. And what's that like if you go and see a psychologist in Australia versus if you did coaching. So I'm going to go through this quickly because I don't want this to be super long, but the main difference, I suppose, is regulation. Regulation is super, super, super important if, in my opinion, you're talking about acute mental health, super vulnerable people, and people who get to a point with their wellness where they potentially are no longer in control of their choices. So that needs to be regulated because the potential for harm is huge. Having said that, just because you work and see someone in a regulated industry, whereas if they hurt you, you can go and make a complaint, it doesn't mean you're protected. There are sharks in the water everywhere, and some of them are very educated and very well trained. So it's not like you're protected from everything if you go and see someone just because a profession is regulated. But also, if you go and see a coach, which is an unregulated industry, it might be someone who is also a psychologist, has a lot of life experience, has a lot of ability to serve and hold someone, and isn't just a yeah, got it person when they actually don't got it, particularly if what you're dealing with is suicide, depression, like really serious stuff. You need to know that you can hold someone and their trauma and everything that they're going to bring to the table, and you're not going to make them worse. So yeah, if you're dealing with someone who's unregulated, that might free you up to do lots of things that you can't otherwise do as a therapist or as a client. So unregulation is not necessarily a bad thing, but there needs to be, I don't know if there's such a thing as balance, but there needs to be, I guess, a clear, okay, what would be the pros, what would be the cons of doing one or the other. If you're in acute mental health crisis, coaching's not for you. It's just not. Maybe once you've got through the crisis point in your life and you've got secure housing, you're settled, you've maybe got a job, you've got a supportive system around you, your general health is okay, maybe then, not for acute mental health crisis, in my opinion. So that's the first one. The next one is whether you use a medical model or not. Most of us who train in Australia still train under the psychiatric medical model. We assess, we look for symptoms, we diagnose, we treat, you hopefully send people on their way. Because if you're accessing therapy under Medicare, so as in you want to get a rebate, going to see a psychologist or potentially a social worker, a nurse, or someone who's employed under that scheme and can give you a benefit, you need a diagnosis. Therapy is not, like sometimes people think therapy is free in Australia. It's not. There are some people who bulk bill. You cannot make a sustainable private practice out of that, by the way. Separate video. But it's not free. You still have to pay something, but what you get back might be like, you know, $124.50, for example, if you see a clinical psychologist. So we have a lot of people in Australia, I would say, who don't necessarily have a clinical diagnosis, but who come and see someone like me so that they can get the rebate. So if you're okay with being diagnosed with anxiety, depression, adjustment disorder, something like that, doesn't bother you, fits with how you see your life, or it's just like, okay, that's something we have to do, that's fine, then do that. But for a lot of people, that being pathologized, I suppose, and that like, oh, I'm broken and I have to go and get fixed, it doesn't fit with their experience and it doesn't fit with where their life is at the moment. So, you know, grief is not a diagnosis. Going through a relationship breakup is not a diagnosis. Losing your job is not a diagnosis. There are lots of things that are cause people a lot of pain and suffering, and they get stuck on, that don't fit within that pathologizing medical model. So doing coaching frees you as a client up, and it frees me up to not be like doing like, all right, what am I going to diagnose you with so that you get your rebate? It's a good system, potentially, but it's not a perfect system, and there are a lot of reasons for not seeking support through a government funded scheme, potentially. Okay, the next one to think about is just the accessibility. So in Australia, generally speaking, again, to get a Medicare rebate, this is the point of reference I'm talking about. Not every psychologist offers a Medicare rebate. Not everybody cares about a Medicare rebate, despite what a lot of people in psychology think. The idea that you could see people outside of that scheme, like it's only been in since 2006. People used to see clients before it came in. Anyway, what was I talking about? Oh yeah, access. Right, so only recently is it even a thing that you can access a Medicare rebate by talking to someone on the phone, or potentially like on Skype or Zoom or something like that. But you also have to prove that you live in a rural, remote area and that you can't find someone to see face to face. It's just one of the caveats. It's potentially improving, and now with all the bushfires, there are lots more people who need to be held in a container of support, and so online and phone is going to be super important for that. But of course, some things do need to be face to face. Some people work better sitting in a room with another body, and definitely for severe acute mental health crisis, that needs to be an in-person thing. When you're managing risk and physical, emotional, otherwise safety, yeah, that needs to be in person. And so there are some things I wouldn't manage, I wouldn't treat online or on the phone because I need to see someone. But I don't really do acute mental health work anymore. So coaching for me is perfect because I can see someone anywhere in the world, and the law, insurance, the red tape of how all that stuff works isn't going to necessarily prohibit me. Whereas if I just work as a psychologist, I can't see people in the USA and Canada because of all the legalities, insurance, all that kind of stuff. With coaching, I can see anyone in the world. You know, and two of the coaches that I've worked with who are like, you know, the perfect people for me, well, oceans and oceans and oceans away. And so being able to access someone globally, that's amazing. Huge bonus in my mind in terms of being able to work and choose when you want to work. That's one thing. I guess the timing and structure, as far as I see it, they're actually kind of similar. Coaching and therapy are both, as far as I have trained and as far as I practice, pretty structured. There's a goal, there's results, you measure them, and there's generally, okay, this is in the time frame that we're going to hope to achieve it. It's not like with supportive counselling or psychoanalysis, psychotherapy, something like that, where it's a week-to-week check-in and we sort of just see how you're going. And then potentially, like before you know it, you don't know how much longer you're going to keep paying this person and what they're actually doing for you. And I do know people who've been seeing a psychologist for years and years and years, and they love that that's their support person and they get to vent, and that can be great, that can be amazing, but generally speaking, that's not how I work. I want to send people out with skills and strategies and tools so they can blow those dandelion seeds, fish for themselves, so to speak. Super important to me. And I actually think coaching is quite similar to that. This is what we're going to get you to commit to, and we do it. We don't just go week by week, oh, see how you're going, see what happens. You make a commitment, and I kind of like that. And I suppose the other thing to mention with coaching is it's the freedom to, for me, as someone who technically, if I work under Medicare and giving people rebates, there are certain things, certain approaches that technically I'm not really supposed to do. I'm not really supposed to offer. Even like procedural things like, should I share my personal story about struggling with whatever it might be? Or is that crossing a boundary? Is that unprofessional? Coaching, it's a bit more relaxed. And I feel like the therapeutic relationship is not so like I'm up here and you're the expert and you're down here and you're the client, which it never should be like anyway. But you don't really learn a lot about your psychologist necessarily because we're all trained in this like, don't let anybody know anything about your life, which is fine when you're working with sex offenders and really dangerous people. But again, I don't work with sex offenders and criminals and really dangerous people anymore. It's a bit different. So there's those things in place to keep people safe and keep things professional. But when you're not dealing with acutely unwell, dangerous, whatever other people, I think you can let a little bit more of yourself in. And that helps people because it's that more human connection, potentially. So that's a really fly by the seat of your pants analysis of some of the differences and similarities of coaching versus doing therapy in Australia. Not necessarily how therapy is in America or elsewhere in the world. That's just my experience of training as a clinical psychologist and what I do and what I see. Why would I do one over the other? If you have questions, just ask. I do both. Coaching, therapy, happy to talk about both if I can answer both. From this is how it works in Australia. This is how I've been trained. This is how I practice. It's not a hard and fast rule. This is not gospel. Please don't take it as gospel. Hopefully that's helpful. I'll talk to you next time.